Alrighty, going over chapter 39, care of women with reproductive disorders. Going over what I usually start with, and that being why is that a different flashing colored box? I don't know. So we're going over the questions first in the back of the chapter. So question number 1. A female patient complains of irritability, fatigue, mood swings, and fear of losing control during the days before menstruation. The initial assessment suggests a nursing diagnosis of ineffective coping related to cyclic hormonal changes. Which instruction would you likely promote patient coping? Avoid calcium-containing foods, exercise regularly, have occasional alcohol, consider a sodium-rich diet. It's going to be exercise. Yep. Exercise increases beta-endorphin levels, which promotes mood elevation that can enhance coping mechanisms. Number 2, a 44-year-old patient complains of irregular menses with hot flashes. She is informed that she is approaching the climacteric stage. Her nurse finds the patient withdrawn and crying. An appropriate statement by the nurse would be, "It is not the end of the world. You seem upset. I am here to listen. Everything will be all right. Aging is not for the faint of heart." 2, because everything else is, screwed up. Yep. An open-ended question promotes responses. When the nurse listens, the patient will speak. Is the rationale. Number 3. The nurse instructs a premenopausal female patient on how to perform breast self-examinations. Which patient statement indicates understanding? I examine my breasts about 1 week after menses. I can use my thumbs to palpate for lumps and nodules. I should pay special attention to the area between the breast and underarm. I do not have to see the physician for clinical breast examinations. It's either the first or the third. I'm going to go with A. Nope. The answer is pay special attention to the area between the breast and the underarm, and that's because most fibroadenomas occur in the upper outer quadrant of the breast, which is in that area. But you do it at a week after menses. Alrighty, number 4. The nurse is discussing various methods of contraception with a woman. When discussing mechanical methods of contraception that do not provide any protection from STIs, the nurse would specifically include the symptothermal method, Billings method, use of water-soluble lubricants during sexual activity, use of IUDs, or use of oral contraceptives. Mechanical. Well, the first 2 is natural. I have no idea. Apparently the answer is an IUD. An IUD is a mechanical method of contraception that does not provide protection from STIs. The Billings and sympathetic symptothermal techniques are fertility awareness methods, and oral contraceptions are hormonal methods. Okay. Number 5. The nurse empowers a patient who had a right radical mastectomy by providing specific instructions regarding post-operative care of the surgical site and surgical complications. Which patient statement would indicate a need for teaching? Blood pressure cannot be taken on the right arm. I can resume intense weight training immediately after discharge. No injections must be given in the right arm. When gardening, I need to wear gloves. Need for more teaching. Well, that's going to be 2 because you're not going to want to do intense weight training. Yeah. Intense weight training should not be initiated immediately after surgery. A gradual return to activity is best. Alrighty, number 66. A 44-year-old patient who had a right radical mastectomy expresses concerns regarding her physical appearance. Further assessment indicates a nursing diagnosis of disturbed body image. An appropriate goal for this patient would be to participate in activities of daily living, demonstrate acceptance of change in appearance, perform aseptic wound care, state signs and symptoms of infection. Well, if it's disturbed body image, then it would be demonstrate acceptance of the change. Yeah. The nurse would assess for gradual acceptance of changes in appearance as a goal for the diagnosis of altered body image. Number 7. Abnormal bleeding between menstrual periods that is associated with uterine polyps, leiomyomas, trauma, and foreign body is referred to as metorrhea. Yep. Metorrhea means bleeding in between menstrual periods. Oh, sorry, I guess, well, your answers are metorrhea, metrophagia, menophagia, allomenorrhea, pseudomenopause. Alrighty, 8. Which nursing interventions would help relieve symptoms of dysmenorrhea? Select all that apply. Pelvic rocking exercises, cold compresses, effleurage, low-fat diet, and non-steroidal anti-inflammatory medications. Effleurage, non-steroidal inflammatory medications. I want to say the rocking exercises, if that's going to be like Kegel. But that's all. So apparently also low-fat diet too. So the pelvic rock releases endorphins, suppresses prostaglandins, and shunts blood flow away from the pelvic organs, decreasing pelvic congestion. A low-fat diet with foods that are natural diuretics, such as cranberry juice, asparagus, or watermelon, reduces edema-related symptoms. NSAIDs are prostaglandin inhibitors that relieve discomfort. Number 9. The nurse is discussing healthy lifestyle activities with a woman. Which statements by the woman indicate a need for follow-up teachings? Select all that apply. I will use herbals such as angelica or evening primrose oil during menstruation to decrease breast tenderness. I will focus on drinking caffeine-free colas to keep my fluid intake adequate. I will douche regularly with an alkaline solution to maintain vaginal health. I will wear form-fitting nylon clothing and underwear for warmth and to prevent infections. As I approach menopause, I will eat wild yams, cherries, and alfalfa sprouts as a source of phytoestrogens. Well, for sure, it's 3 and 4 because you're not going to douche and you're not going to wear tight nylon clothing. I would think too as well with the colas. Nope, it's just 3 and 4. Douching regularly is not recommended. Wearing loose clothing and cotton underwear helps prevent vaginal infections. Caffeine-free drinks enhance fluid intake because caffeine is a diuretic. Wild yams, cherries, and sprouts containing phytoestrogens which promote vasomotor stability. CAM therapy with angelica and evening primrose oil are helpful in fibrocystic breast disease when used regularly. Didn't know that. The nurse is taking the gynecologic history of a postmenopausal Mexican-American patient. Which techniques would help develop rapport with the patient? Select all that apply. Establish direct eye contact, involve family members, touch the patient, use a polite tone of voice, respect privacy. Involve the family, use a polite tone, and respect privacy. Yes, this culture encouraged involvement of family members. A polite tone of voice is expected in many cultures, and respecting privacy will also increase rapport. Alrighty, we are done with that. So now we're going to go to the beginning and check out the objectives. It doesn't look like there's anything that can be easily answered at this moment. So we're going to go on through and start. Your internal structures of the woman reproductive system is the vagina, the uterus, the cervix, the fallopian tubes, and the ovaries. The uterus is pear-shaped and is able to expand to fit the size of a growing fetus. Ovaries produce eggs, helps them mature. Fallopian tubes help transport the egg. Okay, stages of the menstrual cycle. Your cycle should last 28 days. Not every woman is the same, so it may change versus woman, but in general the ideal is 28 days. The first 14 are considered the follicular stage. In this stage, you got the follicle stimulating hormone that says, hey, ovaries, time to make an egg. So the ovaries start producing an egg, and the follicle is like, okay. The follicle stimulating hormone is like, okay, I'm going to help you form this egg. And then the egg is formed, and then luteinizing hormone comes in and is like, hey, before you finish, I need to help you mature this egg so it can be fertilized. And then as soon as it's mature enough, the egg is released, and the estrogen are like, okay, it's mature enough, it's time to release. So the estrogen is what causes ovulation, which is the release of the egg. And then you enter the luteal phase, which is mainly luteinizing hormone and progesterone. Luteinizing hormone is like, okay, we're here to make sure the egg stays mature and is good for fertilization, whereas progesterone is like, okay, I'll make the uterus ready, make it all nice and juicy and thick with blood and blood vessels and squishy and all ready for a fertilized egg. And then when a fertilized egg does not implant, everything just kind of shuts down and restarts, and that's when your endometrial lining sheds. And now your blood, menstrual blood, is not just blood, it's tissues and cervical cells and endometrial cells and mucus. So if you ever have a woman ask you that she can't go swimming in the ocean because a shark will eat her, that's false. I even Googled it. The likelihood is so slim that a shark could actually smell the period blood, actual blood that's in it, considering it's masked by other stuff. And then during your menstrual cycle, if you're one of the few people, you might experience a middle schmerz, which is different than your cramping that you get from actual menstrual cramps, which I don't know the name of that at this moment. Middle schmerz is a pain that you feel during ovulation. So it's a pain that you get when you ovulate. It's considered a sharp pain and can be found in the right or lower quadrant, pretty much where your ovaries are. And now we're off to contraceptives. Methods of contraceptives. You got your fertility awareness methods. The main two is the basal body temperature and the calendar rhythm method. You see these a lot with Catholic couples because the religion frowns upon other forms of contraception. So the basal body temperature is you take your temperature at the same time every morning, and you do that consistently for a month. And you should notice that in the middle of that month that you choose, you will notice a small percentage change. Might be, so if you've been running exactly 98.6 throughout the rest of the month, and then all of a sudden you go up to 98.9, that is a sign that you are ovulating. And when your temperature does rise, you avoid coitus for 3 days, but really you should, avoid it for 5 days, because that's how long sperm can stay in the reproductive tract. And then the calendar rhythm method is where you write down when your period started and you count for so you notice when your period starts, and then you track it up until the next period starts. And in between that, it should be approximately 28 days. So you subtract 14 from when the second one starts. 14 days from, so you start with 1, and then you count to the second. And then the second one, you subtract 14 days, and that should be your ovulation period. So when you're in that fertile time, technically you would avoid sex. And then you got mechanical or barrier contraception. Some mechanical ones can include an IUD, which is a device that is stick into your uterus to Okay, well, it doesn't really explain how it works, but it has a hormone in it, which I'm assuming is probably something to deal with progesterone, and it sits in your uterus and ensures that implantation cannot occur. And then you got the male condom, you got the Leah Shield, which is prescription only, and what's neat about that is it also protects against STIs. And then you got the diaphragm and cervical cap. Yes, there's a difference, but to me there is a very minimal difference. And if somebody's going to do it, it has to be with the diaphragm. It's specially made to fit a specific way. But in general, what you do is you have it, you put the spermicidal jelly on the side that's going to be touching your cervix, and then you squat and insert it upward and downward, I think is what it said. inward and downward, so that you hook onto the cervix and you push it all the way around until it like connects with your bony pelvis and your vaginal walls, and you should be able to feel the cervix underneath of it. And you can put that in 6 hours up before sex and have it in 6 hours after sex. You just have to make sure you urinate before, after insertion, and after intercourse. And you got oral contraceptives, which they are either progesterone based or estrogen based. It depends on what you want to have happen. Estrogen would block the release of FSH, which is follicle stimulating hormone. So if you're taking estrogen one, it will stop the FSH from saying, hey, ovaries, time to make an egg. So it wouldn't make an egg. Or start the maturing process of an egg. And then you got the progesterone-based oral contraceptives, and progesterone blocks the release of LH, which, if that's the case, progesterone is like, hey, LH, you're not allowed to mature this egg so that could be fertilized. So LH is like, okay, so your egg doesn't become mature enough to be fertilized. The most important thing, though, is with you're talking to a woman involving oral contraceptives, they cannot have had anything involving clot history. So if they have heart disease, a liver disease, breast or uterine cancer, and the biggest is blood clots or venous inflammation, these are considered contraindications. So if they've had any of this or are at risk for it, you would want them to pursue another form of contraception. The two most common is seasonal and liberal, which we will get to in a minute. You have also emergency contraception, which is a pill or 2 pills that you take the morning after unprotected intercourse, but you gotta make sure that your teenage girls understand that it's not a form of contraception and it's not something they should rely on. The way that the emergency contraception works is in one of 3 ways. It prevents ovulation or fertilization, it slows the transport of the sperm or egg, or it alters the uterine lining to prevent implantation. And it must be taken within 72 hours of unprotected sex. Infertility. You are unable to conceive after 1 year of unprotected sex is when you're considered infertile. Ways, if that's really the case, you can explore various options, make sure that they are doing it unprotected, that they're having sex at least 2 to 3 times a week to ensure the most sperm count in the uterus. Also, males need to avoid heat, such as hot tubs, laptops on the lap, hot baths, tight underwear, hot, sweaty environments, because sperm don't like heat. The balls are hanging between the legs for a reason. Sperm is sensitive to heat, so if they were constantly in a hot, humid environment, the sperm is less likely to survive. Alrighty, menopause. You have officially reached menopause if you have not had a menstrual cycle within 1 year. Depending on the hospital as well, they'll say that it's within 3 years of not having a menstrual cycle. Up until that point, you're either premenopausal, or you're in the climacteric stage. Signs and symptoms include hot flashes, night sweats, your flow will change, your vaginal walls will atrophy, there will be itching, you might have painful sex relations because you're not able to generate enough natural lubrication to do it, and your vaginal pH increases. So if your vaginal pH increases, you're more likely to get infection. Signs of infection include changes in your discharge, itching, redness, and swelling. The biggest is change in any discharge. So if your discharge changes from a gray-white color, you're in trouble. Especially if it's green and smells like fish, then you got a bacterial infection that probably sucks. Words to know: pruritus is itching, dyspareunia is painful sexual relationships. If your patient is prescribed a vaginal cream, please teach them that they should not use that as a lubrication because their partner may get it, which will mess up their hormonal system. I don't know where else I was going with that. Hang on a moment. I'm going to play with something. I was seeing if there was a way that I could show my screen, but alas, that is not the case for right now. Oh, that's trippy. Oh, look, I got video. Maybe. Maybe. Sorry that I'm getting distracted. I'm wanting to. Figured I'd play with this for a moment. This invasion, moment of Arabia, this invasion, this okay, away. That's what I gotta say. Well, that's me. We'll add that for now. Oh, Ho Chi Minh, this is African, mid-stop, gate, clock, Well, this is interesting. On my back, listen if I go last. Oh. Hey, I feel so smart. I got video. Heck yeah. Now I won't have just a black screen. Whoop, whoop. Oh, I guess I should probably refresh this. Okay. Shall we continue, Gidget? Alrighty, menopause. Some health risks of menopause include osteoporosis. Osteoporosis is a decrease in bone mass that relates to risk of bone fractures. The first signs of osteoporosis are a loss of height, which is called a Dowger's hump, and that's when the vertebrae fail to support the back, so they've just become too weak to hold the body in the upright position. Some points you gotta do, so going back to like the creams, for example, if if the patient is taking creams, you gotta warn them that with estrogen hormonal therapy, they are at a greater risk for endometrial cancer, and endometrial is the lining in the tissue in of it itself. So that is haha. Ooh. Hormonal replacement therapy for women who has no longer a uterus. Only include estrogen. So hormone replacement therapy is not indicated for women at high risk for heart disease. Let's see. And then you also have another health risk of menopause is coronary heart disease. The decrease in hormones increases in risk for coronary heart disease due to change in the lipid metabolism and rise in cholesterol. So this is a good time to teach your patient about good eating habits and letting them know that they may have to change some of their habits because their cholesterol levels are more likely to increase. Hormonal therapy we just discussed. Bioidentical hormones. The only thing she said in class was the prometrone, which is the micronized progesterone. It doesn't really go into much detail about it. Some alternative therapies that can help with the discomforts of menopause include homeopathy, acupuncture, and certain herbs may offer relief, but each may have contraindications as well. Phytoestrogens, soy products, vitamin C and E have also been helpful. You can also take soy, black cohosh, vitamin E is a good one for hot flashes. So, medications such as Elandronte or Fosamax is prescribed for osteoporosis. And the biggest teaching point with that is you got to let them know that they have to stay upright for 30 minutes after taking the medication. Alrighty, now we're off to health promotion. Okay then. Estrogens are a contraception. They help with hormonal balances. Their common adverse effect are headaches, migraine, weight gain, breast tenderness, your big stuff, which is why it's contraindicated for women with clot issues, venous inflammation, or heart issues, is because it can make your blood pressure go up. It causes thrombophlebitis, which is an inflammation of your venous system, which makes more sense now. Alrighty, the point of health screening is to usually prevent. However, you have different types. Primary is dealing with prevention. Secondary is early detection. So if you have a family history of, say, breast cancer, you would want to have more mammograms. Or if you have a family history of, say, colon cancer, you would probably want to start having diagnostic like colonoscopies done sooner than you normally would to check for polyps and whatnot and make sure that they are getting looked at so that it's caught early. And then tertiary is you already have it, you're stuck with it, this is how you can deal with it. So with, let's say, what's something I can think of? I don't know. The first thing that comes to mind, I came up with hypothyroidism, which something you would want to monitor for with that is their metabolism is slowed down. So one way that they would want to deal with it is to have a low-calorie diet so that they can metabolize more. HIV, they have it. They got to make sure that they get their medicine. They're getting their blood tests done more frequently. They're keeping their body healthy. They're staying away from places that could bring them into a higher risk of infection. They are, and of course that makes me think of diabetes, so diabetes mellitus, what kind of diet they would want to be on to help lower their risk, maybe even, not really cure it, but get out of the diabetes stage. Exercise, make sure that they're taking their insulin correctly, and all that is to prevent retinal neuropathy, peripheral neuropathy, and retinal something. So an example of primary screening would be teaching a woman how to do a self-breast examination, when to do it, and how to do it. So you would want them to do it a week after they have their menstrual cycle. You would want them to make sure that they examine the whole breast, put different pressure in, also to focus in the underarm area. And like the end of the chapter question said, the reason why you would want to do that is for fiber adenomas, which I can attest to because I got one right there. So that's pretty close to my underarm. Doesn't cause me any pain, and it's just there. Apparently I have a family history of it. You got your vulvar self-examination. You do that once a month. Just be familiar with what your vagina area looks like, so that if anything, lumpy, bumpy comes up, you can go get that looked at. Some diagnostic tests that might be performed. You can have a yearly examination done, which is a nurse practitioner or a doctor coming in and examining your vaginal canal in your cervix, mainly your cervix. They are going to put you in a lithotomy position, which is your knees up and your legs up and spread. Usually your feet are in stirrups, and they will examine your, like I said, your vaginal wall and your cervix. They will also examine your pelvic region, so your bladder, your uterus, your ovaries. They will even do a pap smear, which is a rubbing of the cervix with a special cotton tip applicator, and it's to check for any abnormal cells on your cervix. Diagnostic tests and procedures. We've already talked about the pelvic examination and pap smear. Okay, so we're not that far yet. Endometrial biopsy is a biopsy of the endometrial tissue. So they will stick a needle into your cervix, through your cervix, into your uterus to get a sample of your endometrial tissue. And I watched one of these done. So something you would want to tell your patient is that because they're having the dilation to the cervix for that needle to go into the uterus, there's going to be cramping, really bad cramping, like a bad menstrual cycle cramp. There may be some blood afterwards. It's going to, you might feel some pressure because it's going to be a sucking, like it's not really a needle, so it's like a suction going sucking at the wall. Yeah, I've addressed all that. Your colposcopy, colopo, cervix, scopy, visual of. So it's a intensive visualization of your cervix. This is usually done after an abnormal pap smear. Or a positive pap smear, my bad. It says that photos and possible biopsies may be done of lesions that require further studies. The patient is positioned as for a pelvic examination. It takes a few minutes. There may be some bleeding if a biopsy was done. The biggest thing with that, apparently, is tell them not to wear a tampon until they have healed from the biopsy. Most likely reason why I can think is they're either at a greater risk for toxic shock syndrome or they are at a greater risk for infection. A hysteroscopy, which uterus, scopy, visualization. So it's a visualization of the uterus. There may be biopsies, removal of fibroids, adhesions, and septums. What the heck is a septum mean in this? Google, my friend. Oh, so it's like a nose. So you got a flappy part that separates your uterus. How interesting. I didn't even know that was possible. You learned something new. Back to PowerPoint. Apparently the biggest thing with this is that there may be injury to the cervix or uterine wall, and if it's really bad, if the lining is destroyed too badly, the woman may have difficulty becoming pregnant, and the destruction would be permanent. And then you got a dilation and evacuation, a D&E, once called a D&C. It is the removal of any thing that's not supposed to be there. So hypertrophy uterus lining, retained placenta, tissue remaining from incomplete abortion, anything that's in your uterus that isn't supposed to be there is what a D&E is for. It's done in an operating room. The cervix is dilated, and the uterus is cleaned. There will be mild cramping and bleeding for up to 1 week, which would make sense because if they dilated the cervix and did stuff to the uterus, it would be like after having a baby, your body was just going to react. They also says that your period may be early or late, so let them know that if it's late, they're not pregnant. It's okay. Discharge teaching with this is to report any heavy bleeding. So if there's any heavy bleeding, it's either a hemorrhage or the uterus became perforated. If they do bleed, if there's any clotting, if they have sharp or severe abdominal pain, most likely in the pelvic region, and any abnormal or foul discharge. Mammograph is a visualization of the boobs, the breasts. Tell your patient that if they are going to get a mammogram done, do not wear lotion or deodorant. Deodorant, especially if they wear the non-gel kind, like the rub-on. I asked the mammogram tech. She said that it is going to cause the picture to be unclear and make it look like there's a lot of calcification in the breast, especially on that side. And like discussed, it could appear as a fibroadenoma, which in reality it's not, because it's just deodorant particles. If they do wear deodorant beforehand, they'll be asked to wipe it off with soap and water. Pelvic relaxation syndrome. Where is that? Why is that? Okay, whatever. Okay, pelvic relaxation syndrome. So your pelvic is way too relaxed. Your issues with that apparently is more common in older women because it's a lack of estrogen. So in your older women or women who have had a hysterectomy, or the really weird sounding surgery where your fallopian tubes and ovaries are removed because your body's not producing estrogen. It weakens the tissue structure. Highlight. Vaginal wall and pelvic floor muscles. So you got your different signs and symptoms, which is systole, which is a bladder prolapse, rectocele, which is a rectum prolapse, or intraocele, bowel prolapse, or uterine prolapse. So if it deals with the bladder, you're going to have stress incontinence, you're going to have normal incontinence, urinary frequency. If it's rectocele or the intraocele, you're going to have constipation, or you're going to have diarrhea. Evacuation's going to be difficult or more painful than it normally would. What does that word mean? We just discussed this word too. Painful intercourse. Okay, so uterine prolapse, painful intercourse, and backache. Well, diagnosed. Physical examination. How else are you gonna know if it's, not where it's supposed to be if you don't do an exam? And there's no point in doing a CT for that. Ways that you can prevent it, which is primary, is teach your patient about Kegel exercises. Kegel exercises we can discuss if you give me a few moments to find it. Is it going to be in the urinary chapter, or is it going to be in the disorder urinary chapter? Looks like it's going to be in the disorders chapter. No big thing. Show her a little swing. I am positive I read this somewhere in this chapter. A, B, C, D, E, F, G, H, I, J, K. K-E, Kegel exercises 780. Haha, Kegel exercises. In order to do it properly, to locate the correct muscle, stop the flow of urine while urinating in the toilet by tightening the anus as if preventing a bowel movement. Okay, while laying down, slowly count 1, 2, 3 while tightening the pelvic muscles. Release pelvic muscles slowly to the count of 3. Do this 15 times. While sitting, repeat the above sequence 15 times, tightening pelvic muscles while counting to 3, and then slowly releasing to the count of 3. Stand and repeat the sequence 15 times. Tighten to the count of 3 and slowly release to the count of 3. Do these exercises once a day. If you can do them twice each day, improvement in incontinence will occur more quickly and also prevent this relaxation syndrome from happening. You can do it as ever long as you want, and for this thing, it says you should see improvement within 6 to 8 weeks, and you could do it for as long as 3 months. Oh, no, it may take up as long as 3 months. And another song I do not like. Alrighty, now since we know how to do Kegels, so that's how you would do Kegel exercises, which is the best way to strengthen those muscles. Surgical, you can repair any of the prolapses that may happen. If it's systole or rectocele, it's anterior posterior repair or coloporphagy. I hate words. You would do that through the posterior because your kidneys and your rectum are on your posterior side. You can have a hysterectomy, which is the removal of the uterus. And if they are having a removal of the uterus, they're most likely going to be taking estrogen, unless if they're already postmenopausal. Post-op care, monitor bowel and bladder pregnancy. Does that say that? Yep. The surgery is contraindicated in those who want to become pregnant. Duh. And those who have a urinary tract infection or a blood clotting problem. I wonder if it increases their risk. Well, blood clotting I understand, but the urinary tract infection, I wonder if it's because it would cause them a greater chance of getting an infection, or if it's the medication they'd be on. Post-operative, you would want to monitor bowel and bladder patency, bladder especially if you're doing just a hysterectomy, and the reason being is you're going to be pooling around in that area. A catheter is most likely going to be in, so you want to make sure that everything becomes expelled afterwards. Laparoscopy. Yeah, we know what that is. Disorders of the female reproductive system. Excuse me. She said not to really worry about polycystic ovarian syndrome. Okay, well, just because there's vocab words in it. Polycystic ovarian syndrome is a congenital condition in which many cysts develop on one or both ovaries and produce excess estrogen, which too much estrogen prevents the follicle stimulating hormone from working, which prevents your ovaries from producing an egg, which then makes you infertile. There you go. And then hirsutism, which is excessive hair on the body. What's next? The functional uterine bleeding. You got different words. Oligomenorrhea, which is decreased menstruation, which my understanding is oli means less than, so either your blood flow went from heavy to light, like mine before going on birth control would be extremely heavy, so if it went to light, that would be an unusual sign. Or if you had a very long period, so say you had yours for up to 7 days, and then all of a sudden it went down to 3, that would also be considered oligomenorrhea. Treatment is hormone therapy because usually the cause is the hypothalamus, pituitary gland, or your ovaries. And then you got amenorrhea, which is absent menstruation. Amenorrhea is normal for women who are pregnant. You will have teenage girls. If you have a teenage girl who is very, very active in sports and does a lot of physical activity, her menstruation will be delayed. So say everybody in her peer group had gotten their period at like the age of 12 or 13, she may not get hers until the age of 15, depending on how active she was in her sport. And then you got meteorophagy, yeah, that's how we're going to pronounce it, which is bleeding in between the menstrual periods. So you had your period on the 1st, and you're not expecting your period again on the 1st, but then you start bleeding on the 17th of the month. That would be what that is. And then you got menophagia, which is excessive menstrual bleeding or extended duration of the menstrual period, which is the opposite of oligomenorrhea. So if you went from very light 3-day period to a super heavy 7-day period, that's abnormal. Abnormal uterine bleeding. Okay. Elder care points. Vaginal bleeding in elderly women is a possible warning sign of cervical or uterine cancer. You need to have an immediate pelvic examination, because if you're postmenopausal and you're bleeding, you're not supposed to be bleeding. Point exactly. Premarin, which is an estrogen. It says severe bleeding may be treated with intravenous conjugated estrogens, which is Premarin, until bleeding stops or slows significantly. Endometrial VX, I'm assuming that's biopsy. Leiomyoma, which is a fibroid, which is a benign tumor of the uterine muscle. You may experience backache, lower abdominal pressure, constipation, urinary frequency, incontinence, abnormal uterine bleeding. What in the world am I listening to? You would treat this with NSAIDs, oral contraceptions. In severe cases, Lupron or Cinereal, which are gonadotropin releasing hormone agonists that shrink the fibroids. They pretty much suppress estrogen. Do you have anything about surgeries? Yeah, embolization. Well, with the post-op teaching on this, I just saw it, includes avoiding the use of anticoagulant drugs, aspirin, douches, sexual intercourse, and the use of tampons for 4 weeks post-operatively, monitoring urine output, preventing constipation, and returning for follow-up care. You got the myomectomy, which is myomem is your word for the uterine tumor ectomy, removal of a tumor, yay! And then a hysterectomy, removal of the uterus. Fibroids can eventually return. I'm so done talking about this right now. I got 1, 2, 3, 4, 5, 6, 7, 8, 9 pages. We can make it. Alrighty, endometriosis. This is a disorder of the endometrial tissue, which is inside your uterus. It can be found outside the uterus, particularly on the ovaries. Based on personal experience with a family member, endometriosis, if not caught early, can cause infertility because it clamps down on it. So instead of like her ovaries going like buggy ears, her uterus kind of, like that, so it looks like a bug head. Hers look more like that, like her ovaries are like been attached to her uterus. So that's how it's kind of supposed to look, and that's how hers look. It causes intense pain. You get intense cramping when you have your menstrual cycle. If you have a surgery done on it, it can cause further adhesions, and it's not guaranteed that it works. The most common treatment for it is some sort of contraception. In the book, I know it says Depo. You can also take oral contraception. And the reason why you would be taking that is it's endometrial tissue, so it's still going to act like endometrial tissue. So when you reach to that point of the month where it's time to have your cycle and slough off all of that tissue, it's going to want to do the same thing, but it's inside your body. So it's going to want to like bleed out, but it can't because it's in your pelvic region. Lupron can also help, which is something that you can take. They create a pseudomenopause. Excuse me. Just can't Alrighty, so your vaginal wall is full of normal flora and a pH acidic environment. If any of that changes, you can either have a bacterial or yeast infection. Yeast infections tend to be the most common. Bacterial usually will happen if your pH changes or you got a wet, moist environment. Bacterial is going to be asymptomatic on onset. You're going to have a very noticeable fishy odor, especially after intercourse. There isn't going to be any itching. Your discharge may be thin, gray, frothy. If it's green, it's really bad. If it's yellow, it's still really bad. And then yeast, it's going to be abrupt preceding menstruation, because menstruation changes your pH balance as well. You may have an odor, musty odor, so like you haven't bathed, or if you've ever baked bread, that like growing yeast smell. You're going to have severe itching, and your discharge it's going to be thick, it may be white, and if colonization is heavy, you're going to have a cottage cheese. It's going to look like cottage cheese, which just sounds disgusting. So, on that note, to help a woman prevent themselves from getting a way you could teach a patient to prevent themselves from getting a yeast or bacterial infection is bathe properly, try not to soak in a hot bath for a long period of time, and if you do, dry properly, don't douche, wear loose cotton underwear. If you're working in an environment that you might sweat, it's another reason to wear cotton underwear. And then off to toxic shock syndrome, which your symptoms include a sudden spiking fever, flu-like symptoms, hypotension, generalized rash resembling a sunburn, peeling skin on the palms or your soles. The thing you would want to deal with that is anything that may be inserted into the vagina. Do not leave in the vagina for longer than 4 hours. Longer than 4 hours, you're at a greater risk of toxic shock syndrome. And that means anything inserted into the vagina. Alrighty. Warning signs of ovarian cancer. I wonder about that. How is it if your ovaries... I don't know. Alrighty, vulvar cancer. So you're gonna have changes in your vulva. So it might change colors. You might get a bump. Usual treatment involves the removal of it. Alrighty, cancer of the cervix. Risk factors include multiple sex partners, sexual intercourse with an uncircumcised male, starting intercourse at a young age, younger than 20 years of age, multiple pregnancies, obesity, and history of HPV infection or an STI. Way you can prevent that is get regular pelvic examinations and pap smears. Treatment may include a cryosurgery, electrosurgical incision, surgical conization of the cervix, which I don't know what that word means. Oh, so it's a cone removal of the area. Cancer of the uterus or endometrial cancer, which if they take what will increase their risk for endometrial cancer? Estrogens. Hormonal therapies. Treatment of choice is a hysterectomy with bilateral salpingo-orophorectomy, which is the removal of your fallopian tubes and your ovaries, followed by radiation and chemotherapy. Cancer of the ovary is considered a silent killer. Symptoms of ovarian cancer include abdominal pain, feeling full quickly when eating, feeling a frequent or urgent need to urinate, increased abdominal girth. Wonder if that's just because the tumor grows and grows and grows and puts pressure on your bladder and your stomach, though that wouldn't make sense, considering your stomach's further up. If they have the BRCA1 or 2 gene, they may be at a greater risk, though that's usually associated with breast cancer, not so much ovarian cancer. They may have a panhysterectomy, which is the removal of the uterus, the fallopian tubes, and the ovaries. Benign disorders of the breast, fibroadenoma, which is a firm, rubbery, mobile nodule of tissue in the breast. So there's no pain, it feels like a node, and it moves. Haha! And it's in the upper outer quadrant of the breast, which is why you gotta focus on the breasts in between near the underarm. That's interesting to me. Intraductal papilloma is elevations in the epithelium of the ducts of the breast under the areolae. The ducts erode, causing serosanguinous discharge from the nipples. Treatment is excision of the mass. And then you got breast cancer. Risks for breast cancer, the biggest factor is age and gender. What gender? Female! Yes. Females are a greater likelihood, but males can. If you are positive for BRCA1 or 2, you also have a greater likelihood of having breast cancer. Signs and symptoms include a nipple discharge or change in the skin pattern, such as a dimpled skin on the breast. May also be a sign of breast cancer. Any unilateral breast change should be immediately reported to a healthcare provider. So, if benign is firm, rubbery node that moves, breast cancer would be the complete opposite. It may be squishy, it would not move, and it wouldn't feel like a node. And the unilateral part is important because you might have it on one breast but not the other. So if you feel something on this breast and you don't feel it on this one, that may be an issue. Or all of a sudden this one looks bigger and isn't fitting into your bras as well as this one is. That would be something to look out for as well. Your drugs of choice are tamoxifen, which is a prophylactic medication for breast cancer. However, you do have risk factors from the side effects, such as bone pain, photosensitivity, headache, increased risk for pulmonary embolism or uterine malignancies. Then you also got aromatase inhibitors. Which I'll deal with stopping estrogen. Okay, tamoxifen blocks estrogens by binding with the estrogen receptors. This drug is usually prescribed for 5 years. So if it blocks the receptors, say this is your receptor, estrogen. That's funny. Okay, so you got your receptor, this is estrogen, and it wants to go this way. However, tamoxifen comes in and goes whoop, so estrogen can't come in. And then your aromatase inhibitors reduce the risk of occurrence by inhibiting the enzyme aromatase, which results in decreased estrogen production. Complication after a mastectomy is lymphedema. Lymphedema is a swelling of the arm. You don't have the lymph nodes there to help cycle and push the lymph through, so it can become stasis if there's trauma to the arm, such as a tourniquet, a blood pressure cuff. Ways you can help reduce the risk of lymphedema during the post-operative care from a breast node biopsy or breast cancer surgery includes no blood pressure, no injections or venipuncture, provide meticulous skin care, teach the patient to wear gloves in the kitchen and when gardening to prevent skin irritation or injury, teach the patient to avoid heavy lifting, wear a compression garment during strenuous activities, elevate and exercise the arm daily. And we are finally done with that chapter. Did I miss anything that looks important to know? Upper outer for your fibroadenoma. There's a lot of information on this. Okay. With you, your body, everybody, with your body, come on, everybody. A patient underwent a total hysterectomy for endometrial cancer 4 days ago. Her physician informed her yesterday that the cancer has metastasized to her lungs. When the nurse tried to talk to her about discharge plans this morning, the patient stated, "What's the point of making plans for the future? There isn't going to be any," and started to cry. Which diagnosis is the most appropriate to this situation? Ineffective coping. Which symptom indicates that a woman may be beginning menopause? Menstrual irregularities, because it would not be cold. Which nursing intervention will best prevent edema following a radical mastectomy? Restricting movement, elevating the arm, moist heat. I would think elevate. A patient who has premenstrual syndrome is likely to complain of which of the following, which of these symptoms several days preceding menstruation? Premenstrual syndrome. A bloated feeling. A patient receiving cytotoxic chemotherapy for cervical cancer develops mouth sores and complains of nausea. The nurse is aware that maintaining adequate nutritional status is a priority. Which nursing action will best help the patient? Provide her with either hot or cold meals, bland diet, fruits and vegetables, antiemetics for meals. Antiemetics. A definite diagnosis of breast malignancy is made by biopsy. According to the American Cancer Society, how often should breast self-examinations be performed? Monthly. Prior to a patient's pelvic examination, the LPN and LVN should take which action? Scrub the area, empty bladder, catheterize, no, empty the bladder. Patient has entered the hospital for a hysterectomy. A hysterectomy always consists of the removal of which structure? The uterus. Which layer of the uterus will become the maternal portion of the placenta? What? I don't know. A patient with breast cancer is being treated with tamoxifen citrate, which deprives cancer cells of the estrogen that makes them grow. This is an example of which type of therapy? Hormonal. When a patient finds a lump in her breast, which of these questions is essential for the LPN to ask because it is an early indication of breast cancer? Do you notice the declining, pain, menstrual regularity, breastfeed? Dimpling. A patient is to have a pap smear to detect abnormal cells. That's not how you confirm pregnancy. Patient is using the basal body temperature method to avoid pregnancy. During which period should the patient abstain from intercourse? 3 to 5 days after temperature rises. The nurse is caring for a patient who has had a mammogram. The physician has ordered additional diagnostic studies to verify mammogram findings. Which statement best explains the rationale for this plan of action? Can reveal many other lesions besides tumors. A woman who has had hysterectomy may have find difficulty adjusting to this loss for what reasons? Fewer children. I'm going to go with that. What is the best way to prepare for a patient for a routine pap smear? Empty her bladder. Cervical cancer is highly responsive to treatment if diagnosed early. What is a known risk factor for cervical cancer? Multiple sex partners. Okay. And that is the end of that.